There are moments in your life that seem normal, that on most days would not stand out. A breezy snack on the back porch, tasting the fruits and veggies from the backyard garden.
Cherry tomatoes.
Yeah.
Simple conversation. Those are the moments so many of us take for granted. Not so for Martha Nixon and her son James. To them, every day like this is a blessing.
Good, feel good to be alive, yeah.
It's not every day you can save somebody's life, you know, and if you can do that, that says a lot for you personally.
For 13 years, Martha Nixon's kidneys had been heading toward failure. As she approached 70, she was looking at a lifetime spent on dialysis unless she was able to find a healthy kidney for transplant. Dialysis is a solution, but it is far from ideal.
Dialysis is a way to survive. Transplant is just quantum leaps above that. Patients go back to normal lives. They stop a couple times a day to take medication, but they're able to go back and become husbands, wives, fathers, mothers, whatever, go back to their jobs. Dialysis is a full-time job. So, I think once they're no longer dialysis dependent, they get their lives back, and that's really what we all are hoping for.
Without hesitation, James, one of 7 siblings raised by Martha and her late husband, got himself tested to see if he was a healthy candidate. Very little time passed between his clean diagnosis and his trip to the operating room.
One of my sisters emailed us and says, we need everybody at the hospital, like Tuesday, to be tested, see if we could donate Mom a kidney. I went in like on a Thursday, and that following Tuesday, I was in surgery with my mom.
Martha Nixon is one of more than 100 people who get transplants of all kinds, liver, kidney, and pancreas, at Virginia Commonwealth University's Hume-Lee Transplant Center. The Transplant Center is named after 2 pioneers in the world of transplantation, Dr. David Hume, who started the program at VCU, and Dr. Hume-Lee, who led the program for 2 decades. The record of achievement at Hume-Lee Transplant Center is extraordinary and includes Virginia's first ever human kidney transplant and first liver transplant, among so many other pioneering efforts. The teams of professionals who have followed these pioneers are continuing to build on these successes, giving patients like Martha Nixon a great opportunity to be treated in an institution that has performed more than 3,000 transplants over the course of a half a century.
I think patients coming in now should know that we've had more experience than practically any institution in the United States in terms of liver transplantation. We started doing it in the early 1980s, and actually I still have some patients in my clinic that are here transplanted from the 1980s.
So when you come here for a kidney transplant, I think you should feel comfortable that the physicians and the nursing staff and the ancillary healthcare people really have put a lot of thought and are well educated in the literature and are up to date in the most cutting edge technologies available for the patients at this point.
For people like Martha, the decision to have transplant surgery is, of course, difficult at best. The news that her kidney was failing and that she had to choose between a lifetime of dialysis and a new kidney was tough to hear.
I cried because I was real nervous and I was scared. And then I got over it.
I think it's important to have a kidney transplant because there are many other organ systems in the body that are affected by kidney failure, so that the cardiovascular system, bone disease, metabolism, things like that, which are affected and continue to deteriorate while patients are on dialysis. The kidney transplant does offer improvements in those areas.
For transplant patients like Martha, the best alternative is a live kidney donor. The wait list, of course, is far shorter and more predictable. Some transplant patients must wait years and even decades. But the live donor transplant is also a better alternative for more years of healthy living.
A deceased donor kidney transplant is a good modality. It offers you, on average, the kidney will survive on average about 7 to 10 years. Whereas with a living donor kidney transplant, on average, you're looking at more like 15 to 20 years. So basically, you double your mileage.
I wasn't scared at all. I wasn't scared. I was happy.
Hello, Ms. Nixon. Dr. Gupta, good to see you again.
Good to see you too.
How are you doing?
Doing fine.
A good portion of James' confidence came from his impression of the staff, doctors, nurses, and team at the VCU Hume-Lee Transplant Center.
They took very good care of me.
The politeness and the professionals go together, and it gives you a chance to breathe a little bit. And they have charts they showed me about this and that, about the surgery, and they was very honest with me, very honest.
Team is everything. In transplant, anywhere, not just at our center, it's everywhere. Nationally, internationally, it's your team. As a surgeon, you can't do anything alone. You know, I mean, I depend on my donor team, my OR, recipient team. I depend on my coordinators. I depend on my nurses. I depend on my ICU staff. And luckily, since we are such an established transplant center, we have everything in place. It works like clockwork. When you do a liver transplant, you cannot have anyone who's not up to that mark. You need to have people who will pass that test.
Another factor in the success of Martha's transplant, and those of so many others, has to do with the unique approach VCU transplant teams take toward patients.
We look at the patient and they may be 70 years old, but they may be physiologically 50. We don't have an absolute age cutoff for transplantation, and I think the workup that we perform on the potential recipients is all customized to the individual patient. One size doesn't fit all in the field of transplantation.
The surgery, however successful, is not the end of the process for the VCU Hume-Lee transplant team and our patients. VCU's Hume-Lee Transplant Center is a comprehensive unit. We build long-term relationships with our patients and their families.
Our experience and our outcomes with our patients speaks for itself. Patients do get back to work. They have normal family lives. They have normal interpersonal relationships afterward. And by and large, most patients are surprised that they didn't have as much pain as they thought they were going to have, and didn't have as much of a struggle with their recovery as they thought they were going to have.
As James and Martha enjoy these breezy moments in his backyard, he shies away from any talk of heroics. He says he simply performed an act of love for a woman who said raising 7 children was a joy.
So like 4 in the morning, they got me up and said, your kidney took to your mother's system, and I thought that was the most rewarding thing.
These people hear about all the complications, they go through the entire process, and they are truly committed to this plan to give a kidney to their loved one. They're modern-day heroes, there's no question about it.
If an organ is failing, it is vital to your career, your family, to your life to consider a transplant, especially a living donor transplant. VCU's Hume-Lee Transplant Center can help you find many extra years of good health, of productivity, and of life, especially when there are so many heroes around.
It gives me a lot of satisfaction, and it doesn't matter who or where you are. I think as long as your outcomes are excellent and you have the satisfaction every day, yeah, I do love doing transplants.
Excellent outcomes are the norm at the VCU Hume-Lee Transplant Center, and the love that follows is being extended for years.
That made me feel very, very good that I got kids that love their mother very much.